Each month on Smart Medicine, we give you the chance to ask the expert. And this month's topic, hereditary colorectal cancer. Our guest today is hematologist and oncologist from the West Clinic, Dr. Brad Sommer. Dr. Sommer, thanks for joining us today.
Thanks for having me.
And our topic today is hereditary colorectal cancer. What is that?
Hereditary colorectal cancer represents a small segment of patients who have colorectal cancer. If you look at the entire population, there's about 150,000 colorectal cancer cases per year in the United States. A smaller subgroup, about 5% of all colorectal cancer patients, that constitutes what we call hereditary colorectal cancer. And in those patients, there's an identifiable genetic cause that is passed on from generation to generation that essentially predisposes them to colorectal cancer and sometimes some other cancers.
So there's implications for siblings and other family members,
Correct,
right?
yeah.
Yeah. Describe the screening recommendations for the general population and for those with hereditary colon cancer, and explain the importance of screening, which has to be one of your watchwords.
Yeah, screening is extraordinarily important and clearly underdone. The importance of screening is if a cancer can be found, particularly a colorectal cancer can be found before it even develops into a cancer, or at a situation where it's an earliest possible stage of colon cancer, then that represents the population that is the most likely to be cured of their cancer. So if you can catch it early or even preempt the cancer from forming, then the patient is to a tremendous advantage when they face cancer.
So, doctor, let's talk about prevention. What preventive measures can be taken?
There are several. In general, it's believed that if leading a healthy lifestyle is first and foremost the general preventative measure, and that includes dietary alterations, high-fiber diet, low-fat diet, low-saturated fat, reduce the amount of red meat in your diet, increasing the amount of physical activity. That's pretty important. Of course, both of those things are not only important for colon cancer, but it's also important in general for a lot of other health reasons. Yeah, but also smoking. I mean, that's in many cancers also, but colon cancer also. Minimizing any exposure to tobacco, or eliminating, I should say, any exposure to tobacco, and additionally, there's some thought that by taking a folic acid and calcium supplementation might benefit as well in someone who is at increased risk.
All right, Dr. Brad Sommer, thank you so very much for joining us here on Smart Medicine.